Hello, my name is Tessa Alexander. I am a registered nurse. I'm currently pursuing my master's with the University of the West Indies in Trinidad and Tobago. So I'm here this afternoon to discuss a simple topic of kidney health maintenance. And what really is kidney health maintenance? So what do you understand by that? But to do that, we have to look at 4 simple objectives. So I do hope that you find this session informative and educational. So we will look at the 4 objectives. We will define the kidneys, explain the functions of the kidneys, identify the effects of unhealthy kidneys, and we will determine the measures in maintaining healthy kidneys. So what are the kidneys? They are a pair of bean-shaped organs, each measuring 10 to 15 centimeters long. They are located on either side of the spine, deep in the abdomen. Each kidney weighs about 160 grams and removes 1.5 liters of urine per day. Together, they filter about 180 liters of fluid every 24 hours, or 50 mils of urine is produced every hour. Most people have 2 kidneys, and I say most people because some persons, although very rare, are actually born with 1 kidney. Now the functions of the kidneys. They filter blood and excrete waste. They maintain water balance. They regulate blood pressure. They regulate red blood cells, and they regulate the acid levels. Now when we look at filters, blood, and excreting waste, they remove toxins, including potassium, excessive salts, creatinine, which is from breakdown from your muscles, and urea, which is a nitrogen-based product of cell metabolism that is produced in the liver and transported to the blood, by the blood to the kidneys. They maintain water balance. They help maintain this water and electrolyte balance in the body as they react to changes which may increase or decrease throughout the day based on your fluid intake. It regulates blood pressure. So it helps regulate blood pressure by producing angiotensin. Now, angiotensin is a hormone that causes the blood vessels to constrict, signaling the body to retain fluid and sodium, hence increasing the normal blood pressure, the body's blood pressure. It also regulates red blood cells. The kidneys produce erythropoietin, which is also a hormone which stimulates the bone marrow to produce more red blood cells. And it regulates acid levels. Acid are products of metabolism. The kidney help maintain proper body pH and acid-base balances to keep the body healthy. So these unhealthy kidneys. Overall, an estimated of 5 to 10 million people die annually of kidney disease. And 6 major killers now is diabetes, hypertension, cardiovascular diseases, HIV virus, and malaria, and now kidney failure. So we're seeing that kidney failure is on the top 6 of contributing factors to death. And according to healthordata.org, in the year 2017, chronic kidney disease was the 4th leading cause of death, with 38.5% right here in Trinidad and Tobago. So we would look at these statistics. Now, this report was taken in 2014 from the United States of America, and it is reported new cases of causes of renal failure. We see diabetes at 44%, and this is the population of persons with chronic end-stage renal disease with the contributing factor of diabetes that caused it. High blood pressure, 29%. So we see how many persons with high blood pressure ended up with end-stage renal disease. And other cases, 20%. The other cases could be hereditary, any type of acute renal failure, causes of acute renal failure, lifestyle and sedentary lifestyle practices, and unknown cases 7%. Now let's look at some of these unhealthy kidneys. We see here this is glomerulonephritis. Now the glomerulus are little organs within the kidneys. They are in the nephrons and they actually filter the blood. So when we have glomerulonephritis, you have inflammation going on in the kidneys. We also have another contributing factor, which is kidney stones, and kidney stones could be lodged anywhere. So these kidney stones could be in the pelvic, it could be in the calyx, it could be mid-urethral, bladder, and also staghorn, because it takes up all the areas deep in the pelvis of the kidneys. Also causing kidney failure could be hydronephrosis. Hydronephrosis is any type of blockage that causes the urine to be backed up into the kidneys, causing dilation and damage to the cells. Another contributing factor is polycystic kidneys. Now, polycystic kidneys is actually a hereditary condition, which means that it could be passed down from generation into generation of the family. So nobody is a genetic disorder that causes kidney failure. So let's talk about maintaining healthy kidneys. So we want to maintain healthy kidneys. So what do? We reduce the sodium intake and take your medication to keep your blood pressure within normal range. So if you are a diagnosed high blood pressure case, a hypertensive patient, if your doctors have diagnosed you with high blood pressure, please take your hypertensive prescribed medication. But ordinarily, we as normal persons who doesn't have any signs of kidney failure should ideally reduce our sodium intake in our foods. Keep blood sugar levels under control if you are a diabetic. Take your medication as prescribed. Avoid taking unnecessary and unprescribed and non-steroidal anti-inflammatory drugs. Now, these are drugs such as painkillers. They are like Divone and aspirin. These are drugs that could be more usage of or overuse of drugs could actually contribute to kidney failure, because these are drugs that are actually filtered by the kidneys. So overuse of them could cause kidney damage. Monitor and take moderate protein consumptions. Now, all these protein drinks that people love to take in their weight loss plans, please monitor them, the intake of them, because high protein could actually cause kidney damage. Keep your regular doctor's checkups. Now, the doctor would want to see you a normal checkup every 6 months or once a year as you get older. Please, if you have a family doctor, visit your doctor, or if you are in Trinidad and you have to visit your health center, please do routine yearly or 6 months checkup. Exercise and weight control. Follow a balanced diet. Quit smoking. Avoid drinking alcohol. And if you do drink alcohol, please reduce the intake. Monitor cholesterol levels. Drink adequate water to stay hydrated. Know your family medical history, because as you can see, or as you have seen, there are other causes of kidney disease that is hereditary. And avoid urine. So avoid urine when you get the urge. So sometimes I know some persons, when they go out, they love to hold their pee, as we would say, until they reach home. Please use the bathroom, because you could now develop a urinary tract infection, and that could cause you to have infection in the kidneys. So these are the type of foods that we want to eat: your creatinoids, your vitamin C's, your vitamin E's, your iron, your sulfur, vitamin A and vitamin B. These are friendly foods to the kidneys. So this is what our plate should look like, where we have more vegetables, your proteins there with your rice and the couscous. So you see how happy the kidneys are here? They are so happy that we are going to drink a glass of water. So please drink adequate water. And the last read, research have shown that 6 to 8 glasses of water is adequate for persons daily intake. So please drink adequate water. And don't forget to exercise. You see the kidneys here that are enjoying exercises, the walks, whatever sports you do. If you run, if you swim, you might want to go out for a walk or start in the gym. Whatever type of exercise you do that suits your age and your body, and what you look at your doctors, follow your doctor's orders. Please exercise. And in conclusion, I would like to say maintaining healthy kidneys is significant to living a good quality of life. Remember, once you have a predisposing health condition such as high blood pressure and diabetes, or a family history that can contribute to getting kidney failure, you should pay particular attention. Don't forget to drink adequate water. Yes, reduce alcohol intake. Eat healthy foods, exercise regularly, take your prescribed medication, and avoid excessive over-the-counter drugs, please. Please maintain your blood pressure and blood glucose levels to keep healthy. And remember, healthy kidneys keep you healthy. These are my references. And on behalf of my beautiful kidneys, I would love to say thank you. I hope you enjoyed. So I'm going to take us some water. I hope you do too. Thank you very much. Bye.